Hello, everyone. So my name is Loren Freitas, and I'm a lecturer in public health at the University of the West Indies. I'm also part of Earth News Foundation for Planetary Health and the Social Innovation Health Initiative Caribbean Hub. And I'm going to give you a short talk on climate change and health, looking at it from a youth and gender lens. And for this talk, I'm going to split it into 3 different presentations, each focusing on a different topic. For this first presentation, we're going to look at the physical health impacts of climate change, specifically the direct and indirect ways in which climate change can impact human health, including things like heat-related illness, vector-borne diseases, and food and water insecurity, as well as injury during extreme weather events. First of all, we need to understand what we mean by climate change. And many of you probably already know this definition, that it refers to the long-term shifts in temperatures and weather patterns, and it is primarily caused by human activities. What happens with climate change is that it can cause rising sea levels, extreme weather events like hurricanes and heat waves, rising temperatures, and increased carbon dioxide levels. So a question that is now commonly asked and answered is if the climate crisis is a health crisis. And most people now believe that it is a health crisis. WHO has been urged to declare climate and health an emergency because of the impacts of climate change on human health. Now, this image here is a popular one. If you ever look up climate change and human health, you might come across this infographic, which outlines the different impacts on human health as a result of the core changes related to climate change. So we will be focusing on some of these impacts in this talk. So with respect to climate and physical health, we're going to look at heat-related illness, vector-borne diseases, and waterborne diseases as some of the direct impacts. In terms of indirect impacts, we have food and water insecurity, forced migration, so when you have to leave your home or your country as a result of a climate event, the socioeconomic stresses, failure of infrastructure, and of course, mental health concerns. Now, mental health concerns have been listed under indirect health impacts, but when we come to that presentation, we'll see that they're both direct and indirect mental health impacts. Let's start with heat-related illness. One of the first things that we want to understand is how the body responds to heat, right? What is the body's normal response to heat? Our normal body temperature is around 37 degrees Celsius. And this is really a balance between the rate of heat exchange between the skin and the environment with the rate of heat that we generate as a product of metabolism. And when our body temperature exceeds 37 degrees Celsius, we have to compensate to bring it back down to that 37 degrees Celsius. And how do we do that? So there are 2 main mechanisms. One is through redistributing blood flow towards the skin so that heat is transferred from our muscles to the skin and then subsequently to the environment. And the other is one that we're all familiar with, which is sweating. So when we sweat, that sweat evaporates and it takes heat with it. Both of these help to cool us down. Now, a term that you're going to hear about a lot when we talk about heat is something called the heat index. And do we know what that means? Because the heat index is not just about the temperature. The heat index is actually an indicator that combines the air temperature with humidity. And It's what we call the feels like temperature. So it feels like it's 40 degrees Celsius when it really might be 35 degrees Celsius. So what happens when there's low humidity? We're able to have higher levels of evaporation, so more heat can be removed from our bodies, and we tend to feel cooler. But when there's a lot of humidity in the atmosphere, it becomes harder for that evaporative process to take place, which means less heat can be removed from the body, and we tend to feel hotter. We also need to know about the heat wave, which is a period of unusually hot weather. Usually it persists for at least 2 consecutive days during the warm period in the year. And at the time of recording this presentation, there's a heat wave occurring across Europe right now in several countries. So when it comes to heat and heat-related illness, we have to think about who is really affected by extreme heat. And it is quite a large number of groups of people. So people who have chronic diseases like high blood pressure and heart disease, they are affected either because of the medication that they're on, which affects how their body responds to heat, or as a result of the condition itself. For example, heart disease, people who have heart problems are directly affected by heat. People with physical and mental disabilities are also affected because they might have physical disabilities where they're unable to move around as fast as other people or get out of hot areas. And mental health because of medication that they might be on, or their ability to understand when they should not be in a hot place. Pregnant women are also affected by extreme heat. We're going to talk about this in our second presentation, where we see that exposure to extreme heat is also having an impact on pregnancy and birth outcomes. And of course, outdoor workers, the homeless, right? People who are directly exposed to heat, even athletes, they are going to be in direct contact with the environment and the atmosphere. And people who live and work in buildings that are not adapted to manage extreme heat are also going to be at risk. So we need to be aware of all these different groups of people so that we can recognize and identify who might be at risk of heat-related illness. Now, when somebody presents with heat illness, there are different ways in which someone can present. So there's something called classic heat illness, which results just from passive exposure to extreme heat. So just standing up and being exposed to hot temperatures can lead to heat illness. There's also exertional heat illness. This tends to be as a result of strenuous activity. So we tend to see this one more in healthy people. For example, an athlete who is engaging in a lot of physical activity, generating a lot of heat within the body, they might get exertional heat illness. And the last one is exacerbation of pre-existing conditions. So worsening of those conditions. Somebody who has high blood pressure, diabetes, or heart disease, and if they're exposed to high temperatures, they might get a worsening of those conditions. And that last one is one that we may recognize less compared to the classic and exertional heat illness. Now, with heat illness, there's actually a spectrum of conditions that people can have, ranging from very mild conditions to severe life-threatening conditions. So we have heat rash, which is really just an itchy rash on the body. Usually it's an area that's covered by clothing and is caused by our sweat glands getting blocked. You also have heat cramps, which is just spasms in your leg as a result of dehydration. And then you could have something a little bit more moderate, like heat syncope, which is where if you're standing up in one position for a long period of time, your blood pools in your legs, nothing is being pumped up towards your heart and your brain, and you might feel lightheaded or like you want to faint. So think about people in a military parade where they're standing up in their uniforms in the hot sun, standing still for a long period of time, they are at risk of getting heat syncope. Then we have the more serious presentations, heat exhaustion and heat stroke. So heat exhaustion is where your body temperature starts to rise, and you may feel tired, you might get a headache, you might feel faint, and your skin might be cool and clammy. And if we don't recognize somebody with heat exhaustion, that can progress to heat stroke, which is the life-threatening condition. With heat stroke, this is where your core body temperature is above 40 degrees Celsius. You have what we call an altered mental state, meaning that you might be confused. And of course, you must have that exposure to heat. Heat stroke is very serious. If you have heat stroke, you're dizzy, you're weak, you might be vomiting, you may even have seizures. And the rates of dying from heat stroke are quite high if it is not recognized and treated. All right, so that is heat-related illness, and now we want to move on to vector and waterborne diseases. So when we're talking about vector and waterborne diseases, a lot of times we're thinking about mosquitoes, things like dengue fever, Zika, chikungunya, malaria. Mosquitoes are common in the Caribbean. This is nothing new for us. But as a result of climate change, one of the things that we're seeing is the presence of these mosquitoes in countries that have never seen them before. So this is an article from October of last year, where mosquitoes were found in Iceland for the first time as a result of rising temperatures. We also have the waterborne diseases like leptospirosis, which is primarily spread by rats. And we tend to see leptospirosis outbreaks after a flooding event. Now, some of you may actually have experienced Hurricane Melissa in Jamaica at the end of last year, and there were outbreaks of leptospirosis occurring after the hurricane as a result of the extreme flooding that occurred. Climate change itself is also affecting flooding by changing our floodplains. We're also seeing that the number of people living in these flood-prone areas is increasing, which means that if a flooding event takes place, there's now a greater number of people who might be at risk of flooding and waterborne diseases. For those of you who live in Trinidad and Tobago, this is an image from San Fernando, the southern part of the country, a car driving through floodwaters. And here on this slide, we have the image on the right-hand side, also from Trinidad and Tobago. These are some severe floods that took place in 2018, severe enough that it actually blocked access to one of the hospitals in the eastern part of the country, so much so that patients were unable to access care and had to go elsewhere. And then, of course, as a result of Hurricane Melissa in Jamaica, several of the hospitals were significantly damaged, which, of course, affected the ability to provide care for people within the country who required it. So when we think about extreme weather events and a flooding event, yes, we have our diseases, the health impacts, but we do have those indirect health impacts, which can affect the access to healthcare and, of course, the physical infrastructure of health facilities. There's also other vectors or other organisms that can create harm as a result of flooding. One of these being flesh-eating bacteria, right? So there's something called Vibrio vulnificus, which can cause a life-threatening condition. And what some of the research is showing is that climate change, again, is changing the ability of these organisms to rapidly multiply. And it's also creating environments that are suitable for them to cause disease. So we may start to see increases in these conditions. Right, so here we just summarize some of the health impacts of flooding into direct and indirect. So we talked about the vector and waterborne diseases, but there's also drowning. There's also hypothermia if you're exposed to cold water. And of course, there are the mental health impacts of being exposed to flooding events. You also have traumatic injuries and the soft tissue infections, which was related to that Vibrio organism that we talked about before, but also things like skin infections, such as something called cellulitis. The indirect impacts, we've talked about the healthcare infrastructure being affected, but flooding also affects food security. Imagine the farmer who's planting on a piece of land and the floodwaters come and wash away all of their crops. That is going to affect our ability to grow and sell food. Income security, people livelihoods can be affected. And of course, people can be displaced from their homes or their countries, depending on the significant impact of a flooding or extreme weather event. Here we just summarize everything that I've just talked about with respect to a flooding event. When you have a flooding event, you can affect access to care. Floodwaters might prevent health professionals as well as public getting to a health facility to seek care. It can directly impact the infrastructure by causing damage to the health facility. It can also cause power or water outages and damage to equipment. Then what can happen is that the quality of care that a health facility can provide is going to be affected, because now if you have a water outage, you may not have access to clean water. If you have a power outage, medications can spoil, and staff may not be able to access the health facility to provide care. Then what happens is that because of a flooding event, because there are going to be different types of injuries happening, people are going to seek care eventually. So you're going to see a large volume of people coming into health facilities for care, and eventually that might exceed the capacity of the facility to provide care. And finally, some of the long-term consequences is that health professionals within the health facilities might experience burnout or traumatic stress disorder afterwards, and staff may not even want to continue working after such a traumatic event. So moving on from there, let's take a look at food and water insecurity. So we've talked about the heat waves. They're becoming more frequent. Alongside that, we're seeing increasing drought. And what is happening, particularly in small island developing states, such as those in the Caribbean, is that we are seeing more people experiencing moderate or severe food insecurity as a result of the heat waves and the drought. And what this means is that people are not able to access food as much as they were able to decades ago. Right? So that brings us to the end of this first presentation, looking at the physical health impacts of climate change. In our next presentation, we're going to focus more on how climate change and gender are related, as well as the mental health impacts of climate change.